We're going to talk about Alzheimer's, and our previous interview was, of course, about the M-Finders, which is an emergency locator for someone with Alzheimer's. But that's pretty much after the fact. Let's talk about people who have Alzheimer's, whether it's minimal, mild, moderate, but they do have it, and let's see what we can do to help them. And so we're very fortunate to have Dr. Barry J. Cutler, who's a board-certified neurologist with neurology clinical research, in our interview, and we are even more fortunate that they have what they call the Expedition Study, and he's going to tell you all about this and how maybe you could be helped by participating in this study. So thank you, Dr. Cutler, for being a part of our show this morning.
You're very welcome. I'm glad to be here.
Yes. Now, of course, as a neurologist, I know that you know so much about the whole field, and lots of people probably come to you to find out, number one, do I have Alzheimer's? Do I have dementia? Or maybe I've just been overtreated or undertreated or something. And that's a good subject also. But let's talk about this study that you're participating in and what people can do, what they're going to get from it, and who is eligible.
Well, actually, we have two studies going on. I'd like to tell you about both of them because patients may be able to fit in one but not the other, or they may want to be in one but not the other. They're both one is phase 3 and the other is a phase 2B. But what that means is that both have been through previous studies for safety and efficacy and so forth, and now is at this phase where we actually test the patients with the medications and see how they do, see how it reflects on their quality of life, etc. The one study is a study that compares the study drug against 3 different dosages of Aricept and also against a placebo. So you have a very low chance of getting the actual placebo. I know that a lot of patients are concerned when they when they talk about these clinical studies or get a phone call from a coordinator or a screener, and they hear that there's a placebo involved. But in this particular study, the chance of getting a placebo is very low. So that's one good thing about that study. The other study, where they will be on a placebo again, comparing that against the study drug. But in this particular study, they could be on the other type of medications that are out there that are FDA approved and being used. So it's not like they'll be on nothing if they get a placebo. So the two studies we have are very important studies. They tackle 2 different mechanisms of action. They tackle 2 different potential causes of Alzheimer's disease, and they're very important studies. It's the one study is actually a study that is testing a drug that can possibly even, I won't say cure. I hate to use the term cure when you're talking about degenerative neurological disorders, but at least it's tackling the pathophysiology or the pathology that's involved with Alzheimer's, that being the amyloid plaques. And so it's an important study, a pivotal study. And I'll tell you that the facility that we have is, first of all, it's a very pleasant facility. The coordinators that work there make it feel very relaxed when you come. I can tell you that both studies have good safety records, that it's very infrequent that there would be any problems even if you do get the medication involved. And one thing that I tell my patients about clinical studies is that as compared to coming to the office for a routine visit, the amount of testing and the amount of expertise that is placed upon examining you and seeing you is a lot more than in the regular office visit. In the office visit, we take a history, we do a physical exam, we give a mini mental status exam, which is a rather brief type of test to see how the cognitive function is in the patient. But when they're in a study, they are tested much more extensively with many more tests to see how the patient is functioning cognitively and personality-wise, and how they are responding to the medication, their quality of life. It's much more intense than it is in just visiting a doctor's office every three to 6 months. So those are the advantages of being in these studies.
Well, that's quite conclusive. I mean, and very, very interesting to hear that. I know that I was in a study. It wasn't for Alzheimer's, it was something else, and I really enjoyed it. They did have the placebos in this as compared to the other, but it was great. And I did get a lot of blood tests. I got a lot of good information from it. But I think having you're saying what you just said. I know when my mother was before she passed away, about a year or two, she was on Aricept, and I know that that's been the drug of choice, or at least one of them for people with it. But I'm glad that there's investigation going on it, because I have been reading that it may not really be as effective as people had thought, and that's what you're trying to figure out. So I am so glad that you're there to do something like this. Now, to be eligible for this, someone has to have been tested by you to know that they have mild Alzheimer's first?
Well, they don't have to be necessarily tested by us. I mean, they can have neurologists that are seeing them, or their primary care physicians could have done a mini mental status exam, and could have told the patient that you have mild Alzheimer's disease or moderate Alzheimer's disease. But when they are brought in for screening for the actual clinical study, we will probably repeat the mini mental status exam that was done previously, whether it be at our office or another neurologist's office or a primary care's office. We'll probably repeat that, because these studies and all of the studies that are being done elsewhere usually have a criteria of a certain a number in the mini mental status exam. In other words, it may be from 12 to 26, it may be from 20 to 26. There's different ranges that it needs to be in order to be in the studies. Now, for instance, the phase 3 study that we're doing with the placebo plus the study drug is a mini mental status exam of 16 to 26. So that is in a mild to moderate range. The other study is from 12 to 24, which is also mild to moderate, but it is a little bit more towards the severe side than the previous study. So it all depends on the mini mental status exam as to which study they can go into or whether they're qualified. But the main idea is that if you're given the diagnosis of Alzheimer's, whether it be mild, moderate, or severe, it would always be good, if you want to be in a study, is to basically call and find out if there is a study that includes your type of Alzheimer's disease or your level of Alzheimer's disease.
I see. Well, that it's so good, though, to have you as such a prominent, renowned neurologist in this field, and having you and Dr. Singer, I guess, is working on this with you. And it's just terrific. And the fact that you're in Sunrise, and so it's very easy to get to. Let me give a phone number. So I think people who have an interest, usually it's the caregiver who will be listening now, and they're the ones who are going to call.
And they have to be, also, not only do they have to call, or will usually call, but they have to be involved in the study with the patient at all times.
Great. All right, let me give a number out. It's 954-475-8171. And I'll repeat that. Get your pencils out. It's Pencil Talk Radio. We're very happy that we have such a wonderful organization who's working with us to be able to get this message out. The phone number is 954-475-8171. Again, it's 954-475-8171. My guest is Dr. Barry J. Cutler, and along with Dr. Richard Singer, they are running the Neurology Clinical Research Inc. organization, and they're also running this Alzheimer's study. It's called the Expedition Study, and what he said at the very beginning, it's a study that is testing certain dosages of Aricept and placebo to see just, I guess, the effectiveness of it. And I think what I'm so thrilled about is I know you said it isn't a cure, and we know, that's a big word, but at least it's going to be able to tell us if there's some very powerful results that this test and this clinical study will come up with. And the one thing also I want to tell everybody, when you're in a clinical study, you could be making history. It's very, very important to think about it. Not only are you going to help your own loved one or yourself if you're listening on your own, but you're part of something that could be much bigger than you could ever believe. Isn't that true, Dr. Cutler?
That is very true. And people tend to forget that when they're concerned about placebos and whether the medicine is going to harm them and so forth. And I can only reiterate that it is so rare in clinical studies when it reaches these phases that there's any real problems, so that you really don't have to worry about that. And the main thing is that you will feel so good that you're contributing to bringing about possible improvement to yourself and to others.
Yeah, that's exactly what I was saying. And so for us to have it in South Florida, you could have something like this in Atlanta, Georgia, and how are you going to get there? But here it is, right here in South Florida. It's easy to get to. Just call that number, 954-475-8171. When we first started the show, in the article that Dr. Cutler wrote on page 19 in the May issue of Boomer Times and Senior Life, it really shows that he has a very diverse background. Neurologists are very special in today because they're very busy with dementia. It probably takes up most of the practice. But on another note, there are all sorts of diseases and what we'll call syndromes that a lot of people don't know much about. And I thought it'd be interesting to talk a little bit about one called restless legs syndrome. I heard about this about 5 or 6 years ago when one of my readers asked me about it and did I know someone or anything about it. And I did some research and it was amazing. This is a syndrome that I'm going to let Dr. Cutler tell you about. And you can actually go and see him. He has a practice as a neurologist also. And if this maybe makes sense to you, run over there because this is be great, Dr. Cutler.
Well, thank you. Thanks very much. Restless leg syndrome is very dear to my heart because I have it. And matter of fact, 1 out of every 10 people in the population has it, even though it wasn't very well known until relatively short time ago. It can be devastating in the sense that